If the sirens weren't sounding already when it comes to strikes, they almost certainly will be now. Ambulance workers are the first of the emergency services to announce walkouts this winter, with 2 strikes planned either side of Christmas, affecting non-life-threatening calls only. Simon's a paramedic and will join a picket line in the West Midlands. In 14 years in the job, he says the pressures have never been so great.
It's very much like you've driven your ambulance into a tunnel and there's no light at the end of it. The level of hopelessness and the decrease in morale of staff is just something that I have not seen in my experience, and many people who have been in for a lot longer than I have haven't seen either.
Like other disputes, this is about pay. The 3 main ambulance unions are demanding above-inflation pay hikes, planning action that affects all but one trust in England and Wales. Trade union rules mean that life-preserving care must still be provided, so things like strokes, heart attacks and major trauma will still be responded to. But the exact details of this so-called life and limb cover are yet to be decided, and it could mean that trips and falls, for example, don't merit a call-out. For the elderly, or for those who require care, it is a worrying prospect. Lisa Rowlands suffered multiple strokes and heart attacks in recent years, but still supports the strikes.
I don't know what I'd do if it happened and I couldn't get an ambulance. That's scary, but what can we do? I mean, they need to do something. They don't get enough money. I mean, it's ridiculous.
So even though you're worried, you still support their cause?
Yeah, absolutely.
But instead of a countdown to Christmas, this is now a December of disruption, with industrial action of some kind planned for almost every day this month. Unions say it was a last resort.
What people don't realise is that the NHS is already crumbling beneath us. It's been a political decision to deliberately underfund and under-resource the NHS for the last decade. And one of the reasons our members are taking this action is because nobody is listening.
The government's proposed a 4% pay offer, with Health Secretary Steve Barclay calling the union demands unaffordable. All sides will be hoping it's not patients paying the price. Ivor Bennett, Sky News.